Please take a seat. Okay.
Thank you so much for seeing me. Must be very annoying when patients miss their appointments. But it was the bus, you see. Fortunately, Mrs. Tembe's been very understanding.
It's not a problem.
When I say it's the bus, that's not strictly true. I was a bit late leaving the house. It's silly, really, because I was going to walk originally, and then I changed my mind. But Dr. Carter said I needed to get more exercise.
So, what's the problem?
New shoes. I should never have worn them. But when I left the house, I was going to get the bus. You mean, why am I here?
Yes.
Yesterday, I was in the supermarket. The one on Higson Street next to the newsagents.
Yeah, I know the one.
Oh, good. Yes. I was standing by the mueslis, trying to decide between the crunchy clusters and the hazelnut flakes, when I suddenly started to feel very strange. I didn't know what to do, and I didn't want to make a fuss. But then, someone passing away in the cereal aisle is hardly going to pass unnoticed, is it?
Okay, can you describe your symptoms to me?
I felt dizzy and a bit breathless. More woozy than dizzy. It passed very quickly. I'm wasting your time. I mean, it's not as though I collapsed or anything. I'm...
You know what? I am going to get you just to rest quietly for a moment. I'm going to take your blood pressure, and talking could give us a high reading.
I have been going on, haven't I? It's because I'm nervous. Dorothy's forever pointing it out. She's my...
Shush now.
Sorry.
Dr. Clay, have you had any word from Nurse Lee?
No.
Perhaps she's running late. Well, I hope that is the reason. Sierra went to live with her new family yesterday. The next few days are going to be very hard on her.
I'll keep an eye out for her.
Thank you. Oh,
No, I know.
oh, well, good morning, Leslie.
Not good news?
Your blood pressure is a lot higher than I'd like it to be.
Well, I did start talking again when you were taking it.
Yeah, you did. You know what? I would like to try again in about half an hour. Will you be all right waiting in reception?
Can't you do it now?
Well, there's no point. All the rushing around you've been doing has probably affected the reading. We need to try again when you're feeling a little bit calmer.
The thing is, I've got a visitor coming later. My sister-in-law. I wanted to go to the shops before she arrives, and I've got to clean the house. She's very fussy. She's forever plumping my cushions.
What's more important, your health or your sister-in-law's opinions?
Since you put it like that.
Excellent. Be about half an hour, yeah? Thank you, Mrs. Jarvis.
Come in.
Hey, how did the big date go?
Yeah, great.
Bro, I'm really pleased for you, mate. Look, I should apologise for yesterday. Just because my love life's a car crash, it doesn't mean I get to dump on you. One of the things I've learned is that if you find someone that you have a connection with, you should hold on to them for dear life.
Yeah, I intend to. Not easy though, is it? She's been with a boyfriend for 10 years.
10 years? That's longer than a lot of marriages. So what's the deal, you know? Do they own a place together? Have they got kids? Oh, come on, man, you don't even know if she's got kids or not.
Kids? Well, come on, nah, she would have mentioned that, surely.
That should keep you occupied until lunchtime. You can use Howard's office. You know where I am.
What's going on in there?
Oh, he's just in a strop as usual.
Dr. Carmichael, you are aware of Nurse Lee's personal circumstances?
Her little sister.
Well, last night she went to live with her new family. It is a heartbreaking situation. She has been sister and mother to that little girl. It's a painful decision having to give her up.
I can't imagine.
Well, as her friends and colleagues, it is our responsibility to rally round.
Of course we will.
What?
I was just telling everyone that it's the staff meeting today at 3 o'clock.
Whatever.
See you later then.
If there's something seriously wrong, I'd rather you tell me.
Yeah, I just want to rule out any underlying medical issues, that's all.
On the other hand, maybe it'd be better not to know.
Any number of things can explain your symptoms. That's why we're taking bloods. That's why we're going to run some tests.
What about cream cakes? I was going to get some for a treat, but I wouldn't want to make things worse. I mean, fat's not good for blood pressure, is it? Or is it just salt? I've got a leaflet. I wonder if I've thrown it away.
Mrs. Jarvis, the odd cream cake is not going to do you any harm. However, worrying about every single little thing in your life, that's not doing you any good.
So I've got to stop worrying.
Exactly. We will give you a call as soon as your tests come back, yeah?
Dr. Haskey, may I ask you something? Should I stop playing bridge? I partner my sister-in-law once a week. And it's such a nerve-wracking game. All those decisions, all that responsibility. Dorothy hates to lose. On the other hand, the social aspect is lovely.
That's it. You make 2 lists. The pros and cons of playing bridge. The longer list wins, and you can use this method for any decision you need to make.
Pros and cons. Thank you, I'll try that. In fact...
2 lists.
Chloe Walters. Go through, I'll be there in a minute.
Aisha, do you want to take a break and I'll find somebody else?
What, because I'm not up to the job?
No, because you're upset.
Just mind your own business, Karen.
Mrs. Jarvis, what happened?
Well, I don't know. I was vacuuming the living room and the cleaner cut out.
Your vacuum cleaner broke. That is not an emergency.
Well, yes, it is. Dorothy is coming over soon.
I'm a doctor. I fix people.
But I didn't know who else to ask. My husband always dealt with this kind of thing.
Just call a professional.
Dr. Haskey, I'm desperate.
All right, fine. Look, it's either your electricity supply or it's your actual appliance.
Yes, but how do I fix it?
Well, if it's your vacuum cleaner, then you might as well just buy a new one.
I can't go shopping with Dorothy coming over.
Well, have you checked the electricity supply?
The electricity supply?
Yeah, turn the light on.
It's not working.
Well, then it's your electricity supply.
Oh, no. Don't tell me I've got to get an electrician. This is a disaster. What am I going to do?
Just calm down.
Oh, yes. Yes. I'll try.
Right, you need to check your fuse box.
The fuse box. Where is it?
I don't know. I didn't wire your house.
Well, what does it look like?
It's usually a little grey plastic box, often found underneath the stairs.
The stairs. Got it!
All right, can you see a row of switches?
Yes.
Right, are they all pointing in the same direction?
The big red one's off.
Right. Flip that bad boy on.
You sure?
Just do it.
It's working! Doctor...
I can't hear you.
Dr. Haskey?
You...
You all right?
Sandwich.
Aisha. Aisha.
Coronation chicken. I'm starving.
I didn't know whether to get cream horns or custard slices, so I got both.
You shouldn't have bothered, Jennifer. I'm on a diet.
Oh.
Do sit down. You're making the place look untidy.
Shall I pour?
Give it a chance to brew. I do hate wishy-washy tea. You're probably wondering why I've arranged to see you on a non-bridge day. I have a proposal for you.
A proposal?
I think we should pool our resources and live together.
You want to move in with me?
No, no, of course not. This place is far too impractical. No, no, you'll have to sell up here and move to mine. You can have the back bedroom. It's a bit smaller than what you're used to, but you'll have a lovely view of the garden and no stairs. Old age doesn't travel alone, Jennifer, and your joints are well past the sell-by date. What are you now? 70?
67.
As you know, my poor Harry had had both his knees done by the time he was your age. Not that he had much use out of them. Milk first, dear? The thing is, we're both widows, struggling to make ends meet on completely inadequate pensions. But with the money we could get from this place, we could live like queens. And we'd be there for each other in our twilight years. So what do you say?
I'll think about it.
What's there to think about? Oh, I can see this has come as a bit of a surprise for you. Take your time.
Al, staff meeting, 3 o'clock.
I'm awful busy.
It's not optional.
Who cares about staff meetings? Howard's not here.
Look, you'd better be there.
Well, what are you going to do? You're going to give me a wedgie at home time?
Mrs. Jarvis,
Would it be possible to have a quick chat with Dr. Haskey?
are you unwell?
Not exactly. Please, I'm happy to wait.
As I explained on the phone, Dr. Haskey is very busy.
It really is most important.
He's on the patio, destroying his lungs. I'm sure he can spare 5 minutes. Come with me.
Thank you so much.
What are you doing here?
Your secretary said it would be all right.
I'm not.
Thank you, Ms. Carmichael.
I need your help with a very important decision.
2 minutes.
You know, I was expecting my sister-in-law this afternoon. Well, the thing is, she didn't want to discuss bridge tactics. It was much worse than that.
I'd skip the preamble.
I made a list of the pros and cons, as you said. It's in here somewhere. Here we go. Here we go. But it was a draw.
The clocks are ticking.
Oh, really?
10 seconds.
Oh, dear.
9. 8.
If you don't want to do something, is that a con or is that cheating?
Hang on. I'm going to stop the clock. You make a list of pros and cons when you don't know what to do. If you don't want to do something, then just don't do it.
Oh, really?
Yes, really.
Oh, thank you so much. That's such a help.
You're very welcome. Come on.
And the patient satisfaction questionnaire has been updated in readiness for next month's survey. Can't wait for that. Which reminds me that Howard has given us these few words to read in his absence. Colleagues, friends, we've been through some difficult times these past few months, facing one crisis after another.
Do I look pregnant?
The fact that we survived is down to you. Your commitment, fortitude, and composure. Your unwavering loyalty and determination. Anyway, we lost a few patients, but down to the excellent work of the reception team, we also gained some patients.
Aisha.
And now I'm going to tell you who the winner of the hamper is.
Pathetic.
So, Valerie came a very close second, despite having not been here for 2 weeks, but the winner is Mrs. Tembe.
No.
Good work. Well done.
Well, thank you. Well, I will be giving it to someone who is in more need of it than I.
Well, you won it. You may as well flipping enjoy it.
That's marvellous. Ah, here she is. Jennifer, this is Mr. Green. He's an estate agent. I thought a valuation would help you see sense. Guess how much? £200,000. Mr. Green says he's got buyers queuing up for a property like this. Just sign the contract and he'll get the ball rolling.
No, I'm not selling.
But we agreed it would be the best thing. I'm sorry about this. I'll give you a call once she's come to her senses. Jenny, dear, you can't possibly afford to keep this house on once you've moved in with me.
I'm staying here.
Don't be ridiculous.
I'm not being ridiculous. I've taken advice.
Who from?
Dr. Haskey.
Your doctor? This has got nothing to do with your doctor. I need to speak with Dr. Haskey now.
Well, may I take your name?
He won't know me from Adam. I'll introduce myself.
Dorothy, this
Jenny,
isn't a...
let me deal with this.
Dr. Haskey, there is a woman in reception to see you. Yes, I think you had better come now.
Mother.
I'm so sorry to bother you at work. Do you have a minute?
Yeah. Sure, come through. Heather is fine.
I've left Phil.
Well, that's great.
Really? You're pleased?
Yeah, of course.
I've never done this before. God, what have I done?
You're not sorry.
No, it's just, it just happened all so fast. And it's not just Phil I've left. My home. I've got nowhere else to go.
How dare you tell my sister-in-law that we shouldn't move in together?
What?
Dorothy, you've misunderstood.
Don't think I don't know what you're up to. Ingratiating yourself with a frail, vulnerable lady.
I'm sorry, am I being accused of...
I know your game. And if you think you're getting your hands on her assets, you've another thing coming. This is not a laughing matter. Jennifer, has he suggested you change your will?
Okay, I'm going to stop you right there.
Don't you tell me what to...
Zip it! You are making completely ridiculous accusations. I have no designs on Mrs. Jarvis's assets. We never even discussed her living arrangements.
Jennifer?
You've got the wrong end of the stick.
Wrong end of the stick. You said your doctor had advised you not to move in with me.
We never discussed you or the house, not specifically. You said that I didn't have to do what I didn't want to.
You don't want to live with me? Why not?
Well, it's difficult to explain.
Give me one good reason. Go on. See, you can't.
Maybe she doesn't want to live with a bully.
Bully? Bully? She wouldn't have a friend in the world if it wasn't for me. Tell him everything I've done for you. Go on.
Oh,
Mrs. Jarvis?
Oh, for heaven's sake.
Right, you, out. It's okay. Let's take deep breaths and in.
I'll be done in an hour or so if you'd like to wait.
I won't be in the way.
No, I won't be in the way. Miriam Cross, please.
oh dear, I'm sorry. Sorry.
Jennifer, listen to me. You are perfectly safe. Is this what happened in the supermarket?
It was worse this time. What's wrong with me?
I think that you are suffering from anxiety attacks.
Anxiety attacks.
Well, making a decision makes you feel really anxious, doesn't it?
Oh, when Dorothy was going on like that, it was awful.
having to choose between 2 breakfast cereals can bring on an attack, then, well, I hate to think what having to make a really big decision like this is doing to your stress levels.
If only Alistair was still here, my husband.
Alistair? It's a good name.
He was a good man. He passed 9 months ago.
No. I'm sorry.
He used to take care of everything. I miss him so much.
Yeah, of course you do.
Oh, maybe I should move in with Dorothy. I mean, I know she's bossy, but at least then she could make all the decisions.
Is that what you really want? But sometimes having no choice can be a whole lot worse.
What should I do?
I think you already know.
You're not waiting for Dr. Haskey.
Oh, no, I'm not a patient. I'm a friend of Dr. Clay.
Girlfriend?
Yes.
You can come back in now, Mrs. Boyle.
I take it you're feeling better?
Yes, thank you. I have an anxiety disorder.
Nerves. I could have told you that.
Dr. Haskey is going to arrange for me to have a course of CBT. That's a therapist.
Therapy. Jennifer, you don't want to dwell on your troubles.
I won't be moving in with you. I've discussed it through with Dr. Haskey, and we both agree that it would be bad for my health.
What nonsense. How could living with me possibly harm your health?
Your unswerving conviction would undermine her nascent urge for independence.
What's that supposed to mean? You don't want to. That's the real reason. At least be straight with me.
No, I don't want to. I find you overbearing and unbearable. And I don't like strong tea.
How dare you? I make you a kind, generous offer, and you just throw it back in my face. Well, I don't want to live with you either. All that dithering you do at bridge evenings, it would drive me mad day in, day out.
Actually, I find the dithering quite distressing as well, as it happens. So I'm going to stop playing. And I am going to find another hobby that I actually enjoy. Watercolors.
After everything I've done for you.
Wow. Mrs. Jarvis, that is 2 decisions you've made in the space of 5 minutes. I'm proud of you.
Mrs. Tembe, sorry I didn't congratulate you earlier. You are a worthy winner.
Oh, well, thank you, Dr. Carter. No, it is wonderful to be appreciated. But it truly is a team effort.
Yes, teamwork is what it's all about. Of course, some people realise that more than others. Shame Aisha didn't hang around for the presentation.
Yes, she has had a difficult time of it.
Well, her behaviour this afternoon was a disgrace. Nurse Lee needs to raise her game, and soon. Good night.
Good night.
Have you seen...
Yes, Miss Evan is in the staff room.
Hi.
Hey, sorry for the wait.
Oh, it's fine. I was just reading up on your job. I think I understood one word in 5. No one's going to believe this. I can barely believe it.
Well, you haven't told your parents yet.
They're on a cruise. I didn't want to break the news to them over the phone. This is the craziest thing I've ever done.
Yeah, we've got some knowledge gaps, haven't we?
That's easily fixed. What would you like to know?
Okay. This is weird. Do you have children?
Not yet.
So you'd like them?
Very much. You?
Oh, yeah, definitely. Yeah. Your turn.
Okay, what's the craziest thing you've ever done?
This. Well, although I did appear dressed as a woman on stage once.
Really?
Cinderella.
Panto.
Yep. Apparently I've got the perfect bone structure to be an ugly sister. It was for charity, so... What about you? You've been on stage?
A couple of times. When I was in the choir. Although I hid in the back row.
Well, I don't think you should ever be in the back row.
Oh, Nestle. How are you doing?
Great.
Oh, wait. I thought that you would like a little treat.
You are kidding me. Do you think I'm some pathetic charity case?
No.
A hopeless failure who can't look after a 3-year-old?
I just thought that you would appreciate...
Appreciate what? Everyone feeling sorry for me? Heston's right. I am a disgrace. I need to man up and get on with the job so you can shove your hamper. On second thoughts...
Red call, red call. Urgent assistance required in Mountain Woods. This is PC Carl Dillon.
Go ahead, Kyle. It's Sergeant Hoyt.
I'm being chased. A lone armed male is firing at me.
I want you to meet her.
Sure, in the fullness of time I will.
Tomorrow.
What has this woman done to you?
Kyle, you okay?
Tonight, MasterChef is back. Delicate